Complementary medicine does work. It's a very powerful form of treatment and it's cost effective, and we really feel that people in needy parts of the city of Liverpool should have the opportunity to access good quality complementary medicine.
Liverpool Centre for Health was created in 1992 as a pilot scheme to provide complementary medicine within the NHS. At the time, this was a bold new step, and everyone involved with the project had high hopes that it would help show the potential of CAM to local healthcare. 15 years on, and it's time to tell something of the story of how the project fared, what it has achieved, and how things might go in the future.
Right, I've been coming to the clinic for many years. Years and years ago, I had 2 spinal operations that left a lot of damage, and I've got bad adhesions growing in the spine, which causes the loss of feeling in the legs. Also, I can get really bad attacks of sciatica in the legs, and I've been like that lately for the last 4 months. I go to Christine, and she's my light at the end of a tunnel.
The treatment that has been given me, it's been great. Massage my neck, and I think that's all I can say. Just that if I wouldn't have had the treatment that Dennis has given me, I'd have had my neck, my head stiff, permanent, one way. But he's moving it for me, you know. Made a good job of it up to now.
What it was, I've been going to the hospital for about 15 years. I've had physio, I've had acupuncture. They've done most of the things they could do. And they just said then there's nothing more they can do. Go home and learn to live with it. And we got a new doctor in our practice, Dr. Rayner. I've never met a doctor like her, so brilliant. And she decided to send me here to see Dennis. And I've been coming here since. And he's done a lot of work for me. It made it a lot easier for me. I mean, this leg completely, I didn't think I'd be able to do anything at all with it. There's a big hole in it. And as you can see, the difference with it.
5 therapies were chosen as either having a sufficient evidence base or a history of already being provided within the NHS. After widespread consultation among community groups, complementary therapists, NHS decision makers and academics at the 2 local universities, the therapy team was appointed and the service designed.
I found people very accepting. I thought, as you said, that people come and think, oh, I'm not sure about this. People are very trusting and very grateful. I had thought quite wrongly, if something's available on the NHS, that people would take it for granted a lot more. And they don't. They're very, very grateful. And I say surprisingly accepting of something that, although it's a lot more mainstream, it's still considered a little bit unusual.
I think it's better coming here. As the doctor was only giving you a tablet put under your tongue, and that was it. And telling you to take it easy and all that, you know, which is, it's right, you know, don't be getting excited, you know, worrying over anything. But coming here, it's proved a lot, you know, as I say, 99%.
Well, I've been coming to the clinic now for approximately 5 years. And I discovered homeopathy at quite a difficult time in my life. I'd gone through bereavements, I started the menopause, I lost my partner, and basically I was feeling very low and very ill. And my doctor offered me antidepressants, which I didn't want. I was offered HRT, and I didn't want that. And he said, well, if you're not going to take any of these things, we can't really treat you. And I asked him about homeopathy, and he said, yes, I can refer you. And he referred me to Hilary. And right from the word go, I started to feel that I was going to get somewhere when I started speaking to Hilary. She listened to me, and she prescribed some remedies, altered some things in my diet. And one of the things was I couldn't sleep. I just could not sleep. And after a week of taking these remedies, I started to sleep again. And after that, I started to recover. So I can't praise homeopathy enough for what it's done for my life.
The location was chosen with several ideas in mind. First of all was the idea of developing and testing an integrated CAM service in an area of high social and medical need. Second was the desire to address issues, equity and access to CAM throughout the NHS, and third was the wish to address the idea that CAM was only attractive to more middle class, better educated, better off populations. The area chosen was that of Everton, a typical inner city area showing most of the problems that had attracted much government policy making over the last 20 years. However, despite the usual list of complex and multiple problems, unemployment, poverty, crime, graffiti, vandalism, drugs and prostitution, the area retained a high level of social cohesion and community activity. Initial contact with local resident groups were very welcoming, and the therapy team took part in many local community health initiatives.
It's a deprived